Dr. Stephen, we talked about missing teeth, and that missing teeth can cause havoc, even though we patients don't seem to be quite realizing it at the beginning. From chewing badly, from having a caved-in feeling, from losing more teeth because, like a fence ball, that kind of one supports the other one, all the way to headaches, migraines, neck pains, and all that stuff. Now, what are some of our options these days to replace those missing teeth? And, are some of them, let's say, a bridge, an outdated option, and an implant a better option, or is it just a different option for a different situation? Shed some light on it, please, if you will.
Well, every individual with missing teeth is, as the word implies, an individual. What may be there is no answer for everyone. For some people, a bridge may be the best alternative for replacing the teeth.
Tell me a situation or two where a bridge might be as good or better than an implant, for instance.
I don't know that's as good or better, but there may be a prudent decision made, and that's the decision between the dentist who's completely communicates with the patient and lets them know. An example is, if you're missing a tooth and the tooth on either side of that missing tooth is in need of extensive work, a bridge may be the more efficient and the more easily and quickly resolved solution for that, because you can do a bridge and have that completely done from one tooth to the other with a false tooth in between within a month or less, where an implant is a separate surgical procedure to put an artificial root in, and you would still need to work on those adjacent teeth that need work. In that case, the patient and I discuss in length what our choices and the benefits of one versus the other, both economic and time, and what the patient's willing to do.
Okay.
But they are involved in that decision making. But that is merely one example of when it is somewhat of a dilemma and an individual decision, what is best for the person.
Mm-hmm. You have mentioned it, off screen a little bit ago that, you don't like to, for instance, grind on teeth if not necessarily. So sometimes a bridge where you have to actually grind down sometimes two perfectly teeth on the side in order to put that crown on it and then hang that one middle tooth in the middle, that is kind of not necessarily a good thing. When yet, however, sometimes when the tooth is already broken anyway on the side, then it might not be, that might again lead to doing a crown, a bridge rather than an implant, because the tooth at the side are already broken and need to be fixing anyway. Yes?
Exactly, yeah. I consider your natural teeth, and God-given teeth far superior. If the missing tooth is between two perfectly good teeth, then an implant cannot be anything less than the best alternative in that case, so you don't have to damage or destroy a perfectly good tooth.
Mm-hmm. Now, what about the fact of, when you have an implant, you have an individual tooth there, whether it's 1, 2, or 3 next to each other, it doesn't really matter. They all are individual teeth. Am I correct there?
That is correct.
And apparently they are much easier to clean because they're normally to clean like a normal tooth, so you can floss them. Where when you have a bridge, be it 3 teeth or 4 teeth together, they're basically one welded, one big welded bridge, and you can't floss in between, so you have to floss underneath. Now, for instance, my wife and me, when we go in the bathroom at night, which we do together literally every single night, we go there, and by the time I shower, brush my teeth, shave, she's still brushing teeth. So you understand that, so I'm probably more on the lazy side of doing these things. Do you know what I mean? Would a person like me have more potential to start having gum disease on a bridge simply because I might be too lazy in most cases to go and fiddle and floss underneath and stuff like that?
There is absolutely no question that you would be at much greater risk for both gum disease and even decay on the root of the tooth if you did not sufficiently clean under that bridge. And getting floss under that bridge and properly cleaning it takes very good dexterity and a lot of extra time. In which case, if someone was of that nature, they would not be a good candidate for a bridge, and an implant would be the superior restoration of that tooth.
And in not in all cases, I suppose, but in many cases, a person who is at that stage where he needs a bridge and or an implant, there is a slight chance that he didn't take care of his oral health in terms of cleaning, flossing, and going regularly to a dentist in the first place. So what makes us thinking that after he has a more difficult way to floss, that he will now do it? Am I far off with this assumption?
No, that's a important conversation that I have with the patient before we do a bridge or something, or add anything that is going to create more difficulty for them. If they are not willing to invest time after the investment of restoring that, then we have to try to find the better solution if they're not going to change their ways to maintain that.
All right. So, but to summarize this up, a bridge and or a crown, a bridge or an implant are both good solutions. You can afterwards, bite, chew, more or less like your normal teeth. Am I correct there, or is that not totally true?
Both give adequate restoration and replacement of missing teeth, yes.
Is there one which you think or know lasts longer than the other one once it is placed? On an average, with no doubt, there's no like 100%, but like a good average given the same situation more or less. Would you say a crown, a bridge lasts as long as an implant, or not really, or is there no real data out there?
There's not much data on the longevity of implants. The promise and the research so far is that they would be under similar circumstances there would be more longevity with an implant. But implants of the type that are now placed in the high technology of implantology, they have the promise to be superior to a bridge replacement.
Especially if you're a lazy flosser with a crown, right? With a bridge.
They are easier. They're far easier to care for than a bridge, yes.
Got it. Well, all right. Well, again, very informative, Dr. Stevens. I appreciate it. Thank you very much.
Thank you.